program. As I was saying earlier, Australia recorded the highest number of COVID cases today since the pandemic began, but there was good news with a lot of people in New South Wales and Victoria in particular turning out to get vaccinated. But will our freedoms be restored once we reach those vaccination targets? I'm now joined by Dr. Katie Allen, the federal member for Higgins. Katie, you're not only a politician, you've got a background as a medical researcher, as a leading paediatrician. What is your message to state governments in relation to schools?
Well, thanks, Rita. My message to the premiers is, and the territory leaders is, please deliver on your commitment to the national plan. That's what I want people to hear loud and clear, because we've got this national plan and we have a way out of these rolling lockdowns, which in Victoria are causing an incredible amount of pain and suffering, a shadow pandemic, as we say, and affecting our youngest really disproportionately. You just have to speak to any young family to know the impact that all this lost time from schools is having on children's mental health and wellbeing. We know that in Victoria, we're clocking up more than 146 days of not having face-to-face learning. That's about 40%. Over this pandemic. So this is a really significant amount of time. Now, I know the NAPLAN results have been released today and there's some crowing about how good they are. We're really delighted. It's great that there's great NAPLAN results. But let's just remember, that's grade 3, 5, 7 and 9. It's wonderful that kids are keeping up. But we do know the foundational years are the prep and grade 1 years. That's when children learn to read. So they're not getting their letters, they're not getting their spelling, they're not getting their basics that they need as a foundation for their future. And you just speak to any young family who are dealing with little kids at home and trying to juggle being in a home and having work alongside that. It is really putting huge amounts of stress, mental health on the parents themselves. So I'd like to see a commitment to a COVID-safe plan to open up as soon as it's safe to do so. And I'd like to see, as part of that plan, prioritisation of those who care for kids. So that's parents and teachers, and that's the 20 to 40-year-old age group. They are also the group that are high transmitters. So I'd like to see a prioritisation of vaccination for them. And I'd also like to see playgrounds opened up, because we need kids to get active and be outdoors. Adults are out riding their bikes or walking. Kids, you can't say, come on kids, let's go for a 5K run when they're 3. They actually need to be able to play and to get their exercise in different ways. They're not as structured in the way that they get their outdoor activities.
Well, that's an interesting point you make, particularly for Victorian playgrounds and younger children. I've spoken to a number of parents this week who said their kids were coping up until that ban. The ban had a disproportionate impact because that was a little slice of joy the kids had every single day, and now they don't have that anymore. So do you have any hopes that the Andrews government will reconsider the ban on skate parks, playgrounds, basketball courts and other areas where kids go to play?
Look, absolutely. Look, I know that we have, stepped into this lockdown or stepped up to it. There's more and more layers of things being imposed, not necessarily evidence-based, I will say. But as we want to wind back these lockdowns, as more and more people get vaccinated, then I hope the ones that are less evidence-based are the ones to come off first. And my local council, Stonington Council, have put their hand up to say, we believe we can run COVID-safe playgrounds. Higgins, where my constituency is a very inner-city area. People live in apartments and high-rise building blocks. They don't necessarily have the quarter-acre block. They can't get their kids outside in the same way. It's been a really tough winter. This has been a marathon event for not just Australia, but the whole world with this global pandemic. It's wearing people down. They are really over these rolling lockdowns. They want some rays of hope. The hope is get vaccinated, and we know that Australians are doing this in record numbers. I think we're up to 215 vaccinations per minute. It's an absolute record, up there with the world's best. And Australians understand that their path to freedom and their path to improved mental health is to get vaccinated so that we can move away from lockdowns as a blunt instrument when it comes to attacking COVID, because we want to make this deadly disease less deadly. And there's absolutely perfect evidence that vaccination helps to make this deadly disease far less deadly, in which case the risk balance for what we do becomes better with regards to opening up restrictions and getting back some of those really desired freedoms. We really want to get back to what we can get back to as soon as possible.
Yes, we got some very ambitious vaccination targets, more ambitious than just about anywhere else in the world. And that Doherty Institute modelling we've relied on shows that at 70%, 80% vaccination rate would be sufficient to live with COVID in a manageable capacity. But there are still state premiers pursuing zero COVID. Again, you've got a medical background. You come from this not just as a political leader, but also someone with a fairly renowned medical background. What is your considered advice to those seeking to undermine the roadmap to freedom and pursuing zero COVID?
Look, the Prime Minister has been very clear about this from the very start. We have, as a country, been pursuing an aggressive suppression approach. And it's very clear, particularly with Delta, that countries all around the world have been struggling with this more transmissible form of COVID. There's been a nasty outbreak now in New Zealand. We know that basically we have to learn to live with COVID, and an eradication approach doesn't appear to be the sensible approach. Basically, what we need to do is make sure that we can conquer this disease by making it less deadly, and that is what the vaccination protocols will do. We're seeing the evidence of them overseas, and that is one benefit about being far away from the rest of the world, is we can look to the rest of the world to see how things have worked, and we can see already that the vaccination is having a significant effect in suppressing the death rate to make sure that it's a less serious disease, but we're going to have to learn to live with COVID, as we do for a lot of respiratory infections. And I think some person recently made the comment that the only virus that the world has been able to eradicate in the last 200 years is smallpox. There are no other viruses that we have been able to eradicate. So it is something that we are going to have to learn to live with. There's a number of different vaccinations. They're all very effective. They've been used in millions of people right around the world, so we know their safety profiles. So what we want is every Australian to get vaccinated, tell their friends, tell their families, use it to protect our children, because at the moment there's no vaccination available for the under 12s until the research studies have provided the data, and that is coming in the next few weeks. But it is time for people to realise that vaccination is the pathway out.
Absolutely, and we've got that message, and like you said, we're getting record numbers of vaccinations. So hopefully, when those thresholds are met, we can have our freedoms restored. Katie Allen, thank you for your time tonight.
Thanks so much, Rita.